Hey students, I am going to just do a quick video for you talking about the musculoskeletal system in children. And first of all, I want to show you, you should have this guided reading sheet, which was created, it was intended to help you as you went through your readings, to help you pull out important information, and there was stuff that you were going to fill in. But as you can see, the stuff in red, it's already been filled in for you. Thank you. You're welcome, by the way. I've already done that for you so that, because I know most of you don't read. So I already did the stuff for you, so you kind of have the information there for you. But I just want to point out to you, these are the things that we're going to be talking about. I want to make sure that you can see this in your screen. So I just want to bring this down to make sure that you can see. So these are the things we're going to be talking about, kind of the disorders, the major disorders we're going to talk about. Leg calf perthes, we call it perthes for short. We're going to talk about slipped capital femoral epiphysis, or SCFE. We call it SCFE for short, SCFE. So when I talk about SCFE, you'll know what I'm talking about. Developmental dysplasia of the hip, or DDH. We will talk a little bit about rickets or osteomalacia and scoliosis. And then we'll mention real briefly, we're going to talk about OI, or osteogenesis imperfecta, osteomyelitis, or an infection of the bone. And we'll very briefly touch on juvenile idiopathic arthritis, or JIA. And then, of course, we're going to talk about fractures and casting, and how to care for a child in a cast, and how to and traction a little bit. So that's kind of just the main things that we're going to talk about in this section, that will also go along with our endocrine section as well. These are both of these units, endocrine and musculoskeletal, are pretty small. There's not a lot. You just need to know a little bit about both of these, or they can be very in depth, but from your point of view, it's pretty small because you don't need to know a lot about this information. So I'm just going to show you a little I don't want to make this full screen because I don't know if you can see it if it's full screen. Hold on. Let's do this. So I'm going to go through some just kind of broad concepts here as you prepare for class, because these are the things that I really want you to come to class knowing, so that we can discuss them a little bit more in class. So first of all, these are the priority things that you need to know as we talk about any of these disorders that we're going to talk about dealing with musculoskeletal. These are the things that are going to be prevalent in all of the things that we talk about. First of all, perfusion. Perfusion is going to be affected with anything that we talk about. So the things that you want to really pay attention to are going to be perfusion, movement, sensation, and pain. When you're talking about musculoskeletal system, all of these disorders, okay, don't tell anybody I told y'all this, but here's the deal. They're all dealing with bone issues, right? There's not a lot of nursey stuff here. It's all dealing with bones. They're all diagnosed by x-rays, and they're all treated with surgery. There's not a lot of things that you as a nurse do as far as diagnosing, taking history, things like that, because most of this stuff, it has either genetic components to it or injury to it, and then you get them in, they do x-rays, and then they take them to surgery. Now, post-operatively, you're going to do a lot of post-op care, and most of that stuff you already know. But the things that you do have to really pay attention to are these things that I've just mentioned here. perfusion, movement, sensation, and pain. And that's going to be prevalent across all of these disorders that we're going to talk about. So those are the things that I really need you to pay very close attention to, no matter what we're talking about. When you put all of these three things right here together, perfusion, movement, and sensation, we call that a neurovascular assessment. So neuro is this movement and sensation. Can they move? Can they dorsiflex and plantar flex? Can they lift their leg? Can they wiggle their toes? Can they feel you touching them? Can they feel cold sensations? So that's the neuro piece of it. And then the vascular, of course, is their perfusion. What's the temperature of their skin? Do they have pulses? Do they have cap refill? Okay, that's the perfusion piece of it. So that piece of it. And then, of course, when you're doing surgery or when you have a break in a bone or whatever, you have a lot of pain. So that's the other piece that's priority for these kids. I just want to show you developmental dysplasia of the hip is one of the disorders that we're going to talk about. What does that mean? Dysplasia is when you have an abnormal development of a structure. In this case, it would be the hip. And so basically the hip doesn't form like it's supposed to. Or where it's supposed to. So this is what it's supposed to look like. You have your nice round head of your femur that goes into the little hip socket, the little hole. When you have DDH, the round head of the femur doesn't go into the socket. It goes behind it, basically. Most of the time it's behind it. So you can see what that looks like in the picture, and you can see here in an x-ray where it's not in the right place. It should be down here. That most of the time is treated if they're under 6 months of age or up to 6 months of age. They're put into a harness, what we call a Pavlik harness, and that keeps the head of the femur in the acetabulum. This is what the harness looks like. I want you to take a look at this and tell me what's wrong with this picture. So when you come to class, be prepared to talk about what you think is wrong with this picture, and also what are the implications of caring for a child in a harness like this. After 6 months of age, these children would be treated with surgery. Sometimes they're put into traction before surgery, sometimes not. So you would want to, if they were put in traction, you'd want to think about all the things that you need to do for the care of a child in traction. Okay, remember I talked to you about SCFE and Perthes. In your little handout, it tells you exactly what those disorders are. We'll talk a little bit more about the exact pathophysiology of SCFE and Perthes when we get to class, but I want you to look at the x-rays here. This one over here is SCFE. This is what a normal hip looks like. This is what SCFE looks like. This over here is Perthes, and this is what a normal hip looks like, and this is what Perthes looks like. So you can see it's just kind of flattened out here. Basically, this happens because you don't have vascularization to the femoral head. And this one you can see what's happening here. So just from looking at this x-ray, one of these conditions is considered a medical emergency. I don't want you to Google this. I don't want you to look at your paper. I just want you to look at this picture, and I want you to tell me which one of these you think is a medical emergency and why. So come to class and be prepared to talk about that. Just from looking at this picture. See if you can do that for me. And we'll talk more about it in class. Scoliosis is a curvature of the spine. So not only does it curve to the side, but it also twists towards the front of the body. And so this is one of the things that you can actually look at and see from an outside perspective. And so this picture right here shows you they have unequal hips. Their head may not be centered over the body. Their shoulders, one of the shoulders usually higher than the others. Their clothes don't hang right. The other thing that we do when we screen for scoliosis is ask the child to bend. And when they bend, you see how this is called a rib hump. See how that shoulder comes up? You can see that when they bend over. That's what part of the screening process for scoliosis. The other thing, So this is a kid who had surgery to repair their scoliosis. This is what the child looked like visually from the outside. You can see their asymmetry there. And this is what her x-ray looked like. So you see that big curve. This is post-operatively. Great, great scar right there. That is an incredible incision. And then this is what it looks like afterwards. So what they do with this spine is they actually take it, straighten it out, and then they fuse the spine here, and then they hold it in place with these rods and screws. So because the spine is fused, what are the implications of that? What do you think immediately post-operative, what are the implications of caring for a child who's just had a spinal fusion? Come to class and let's be prepared to talk about that. How do you care for these children, and what are going to be your priority nursing points of care for these kids? Last thing I want to talk about just a little bit is fractures. So in kids, remember that they're still growing. They have growth plates that are open. So that's called the epiphysis. Here's some fractures that can occur around the growth plate. And that's a problem because they may not grow back together appropriately, and that can cause problems with growth. And they can also grow back together and have overgrowth because with the bone being stimulated, it can grow over, and that can cause deformities. So we have to be really careful about that. So I like this little depiction because it kind of shows you how they can grow. It can cut right in half and go through the growth plate this way. It can go through the growth plate laterally or vertically. It can go through like the whole bone plus the growth plate, or they can be crush injuries, which are actually very common in children. And then of course there's casting. And these are just a depiction of all the different types of casts that we have. I didn't like this spica cast, but this is what we use for the hips with the DDH is the spica cast. This right here, the 1.5 hip spica, is the most common that you'll see with that. So think about the implications of caring for a child, and of course this is not a child, but think of the implications of caring for a child in this kind of a cast. And knowing that perfusion, movement, and sensation are the things that you need to be most concerned about. Think about what are we going to assess, and how do we assess that, and what do we do? Like, what are the things that we need to be concerned about with kids in any of these kinds of casts, and what are we assessing for? So that's what we're going to want to talk about in class. So have those answers for me when you come to class. And that is the high points of musculoskeletal care. So I hope that that's helped you kind of put together some of that information. And I'll see you in class. Thanks.